think we're at a good place here where we can start our webinar. I'm going to hand it over to you, and thank you everyone for joining today.
Yay, I'm Dr. Tade. I am one of the founders of Dose Wellness, and I am now working with Heva, and I'm so excited to talk about Retatrutide. This is something that us as providers have been looking forward to ever since we started seeing the clinical trial results come out. And then I'm also seeing a lot of it kind of on the gray market. A lot of my patients are buying it online. So I want to kind of talk about that as well. But let's start from the beginning. Let's talk about metabolic health and what we have available and what's coming. So hit me with the next slide. Love it. You've probably heard of Ozempic, Wegovy, Mounjaro, Zepbound. Basically, those medications are semaglutide or tirzepatide, right? Those are the medication names. The next generation, the next medication that is coming out is retatrutide, and we are just so thrilled about it. Let's talk about the medications that are out right now, and then let's talk about retatrutide. So head on to the next slide. I really love this slide because for so many years, we didn't have a ton of solutions for weight loss, right? We were told to eat less, exercise more, try harder. And now there's been a really big shift in the theory of obesity, which I love so much. It's taking away like the morality of obesity. And we're really focusing on things like appetite, insulin, satiety, pathways in the brain. Just these medications have shifted our whole approach to obesity. So it's been really, really powerful. And okay, so let's talk about Sema and Tirzep. Semaglutide, tirzepatide, I've been using them in my office now for 5, 6 years. Semaglutide was the first on the market. We love her so much. She's like the OG. She's like the sweetheart of the GLPs. Um, we're seeing 10 to 15% weight loss, which is great, you know. We're seeing a lot of inflammation decreases, a lot of other benefits. So semaglutide was out first, then came tirzepatide, which I think everyone was super excited about tirzep. Tirzepatide is now hitting two receptors, and we're seeing that it increases weight loss from 15 to 22%. So this is really the first time we have seen medications be about equal to weight loss results with bariatric surgery. So these medications have been an absolute game changer, and that's why they're so popular. But now we're kind of talking about the next evolution. So let's talk about retatrutide. So, like I said, semaglutide hits one receptor, Tirzep hits two, retatrutide hits three receptors. So it hits all the same receptors that Sema and Tirzep hits, but it adds this magical glucagon pathway. So it's going to work very similar to semaglutide tirzep, where it reduces appetite, it reduces hunger noises, but that glucagon agonist increases metabolic rate and fat burning. So I think that's why everyone is so excited about this new GLP because it's hitting all of these receptors. It's giving you all of these benefits with the additional benefit of the glucagon. And of course, these are great medications. Semaglutide, Tirzep, they basically lower your appetite, decrease how much you want to eat. Retatrutide really activates the glucagon receptor that increases energy expenditure. So this helps with fat oxidation and helps to address metabolic slowdown, which unfortunately I do see quite a bit with semaglutide and tirzepatide. When you reduce your caloric intake, your metabolism slows down. And by adding that glucagon with the retatrutide, that is basically negated. That is canceled out. So instead of this like whole less food in, we get, a reduction in food and increased energy expenditure. And we're seeing 25 to 30% weight loss, which is absolutely unprecedented. So it's very popular right now. Clinical data is super, super impressive. It is in phase 3 trials, which is kind of like the last phase of any FDA-approved clinical trial. We're really seeing how this new generation of metabolic medicine is not just reducing appetite, but it is reprogramming the metabolism. But this isn't right for everyone. This is still such a new medication. We're still kind of playing around with it. So let's talk about who is a really good candidate and who we might want to avoid. Who's a great candidate? BMI over 30, right? Morbid obesity, even BMI over 27 with these additional metabolic conditions like high triglycerides, high blood pressure. We do like to test for insulin resistance. So you can have fairly thin people in a normal BMI, but have really, really high insulin. So these patients would do really, really well with this medication. I also love retatrutide because we're seeing that it is impacting the liver so much more, and it is causing the liver to release those fatty deposits more than semaglutide, more than tirzepatide. I love all GLPs for PCOS. I'm getting incredible results with that. And then, of course, we do a lot of work on the cardiovascular system here. We always test homocysteine, CRP. All of these medications, now especially retatrutide, are going to be very anti-inflammatory for the cardiovascular system. And last but not least, I have so many patients that are absolutely, on a max dose of semaglutide, tirzepatide, and they have plateaued. And, those medications are great because I'm like, look, it got us where we are. But to break through that plateau, I'm really excited to consider retatrutide for them because not only is it going to keep their appetite controlled, but it's going to speed up their metabolism, which may have dropped off since being on the other GLPs. So yeah, really good for if your metabolism has slowed down, maybe from being on the other GLPs, maybe from aging, maybe from coming back from an illness or an injury. If they have a lot of visceral fat or persistent insulin resistance. So if we cannot get control of their visceral fat or their insulin levels, this can also be super, super beneficial. It's not a quick fix. It's not a shortcut, and it's not a replacement for, protein, exercise, all of that sort of thing. We're going to talk about ways to enhance outcomes on any GLP. Really cool studies with retatrutide. So, like I said, we're seeing a lot of reduction in fatty liver disease. Um, Benefits beyond just losing weight. For retatrutide, we're seeing studies off label that it helps with osteoarthritis pain, helps with fatty liver disease, helps with blood pressure, helps with inflammatory markers. It impacts the metabolism in such an interesting way that this is going to impact your energy, your hormones, your fertility, your cardiovascular system, your brain, your inflammation. These medications have shown time and time again that it's more than weight loss. There's so many other secondary benefits. Retatrutide seems to have very similar side effects to all the other GLPs: nausea, vomiting, diarrhea, constipation. Um, Most of my patients, I start them at a super, super, super low, 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 low dose, and I slowly titrate them up to avoid these. And, I have patients that they are terrified to go on these medications because they think they're just going to be throwing up all the time. And I'm like, okay, no problem. I'm going to give you some Zofran. I'm literally going to start you at a microdose, and you are going to increase the dose based on how you're feeling. So not many of my patients have these GI side effects, but that really comes in working with a provider that has been using these meds for a long time and that can titrate you conservatively and effectively. Less common gallbladder issues. I really worry that people lose lean muscle, but I do a lot of lecturing on you need to be eating protein. Maybe need to be doing creatine. We need to be exercising. And very, very few patients have this like GI intolerance. But again, this is all dose dependent and really manageable if you can titrate conservatively and just listen to how the patient is responding. And then, yes, of course, I feel like everyone is really, really worried about losing muscle. And, I've worked with patients that were on getting this from their primary care. They're doing a very aggressive titration schedule, which is kind of like the FDA approved titration schedule. And they said, I'm just going to work. I'm eating once a day. I come home from work. I lay in bed for the rest of the day. I'm so tired. And I was like, well, you're so tired because you're not eating enough. So you're not eating enough. You're not exercising. That is a perfect combination of losing muscle mass. So I would rather keep the dosage low so patients can still eat 3 times a day, keep their calories appropriate, and have the energy and motivation to do some exercise, do some resistance training. I love to measure body composition. I send patients to get DEXA scans. Most of my patients actually put muscle on while they're on a GLP because I'm so aggressive and so passionate about, muscle is medicine. And if you are losing weight and losing muscle, this is really going to set you up long term for a metabolic disaster. Okay. We got to work on all the things, right? And I think that's why it's so great to work with a provider here at Dose Wellness or through Heva. Retatrutide does not fix poor sleep, chronic stress, micronutrient deficiencies, hormone imbalance, gut dysfunction. It helps so many different things, but we gotta work on the basics, especially when people are just starting out on these medications or if they have stalled out. I'm like, we gotta go back to the basics and fix whatever isn't working here. I have so many funny stories about this. I have so many funny stories. I have People have been buying it from the gray market for several months now, and they see it on TikTok or they see it on Instagram, they buy it online. And these are like research only peptides, and they're like, this is not FDA approved for human use. It's like, um, typically they say for animal use only. And, I've had patients spend thousands of dollars buying retatrutide online, and they're telling me, they're doing all these injections, they're not seeing any benefits. And I was like, I don't think this has any like active ingredients in it. So they may not contain what they claim. And that worries me because I feel like people are just wasting their money. I also worry if they're contaminated. There can be endotoxins, which create a rash, could create like, fevers, chills. And then a lot of these gray market ones are actually, you have to mix them yourself. So I had a patient of mine tell me, oh, I'm supposed to mix it with 100 units, but that didn't seem like enough. So I put in 200 units and it's not working. And I'm like, oh my gosh. So that also kind of worries me that patients are incorrectly dosing themselves at home because they don't have the guidance, right? And they're not like being medically supervised. So yeah, incorrect concentration. I worry about it being contaminated with bacteria, endotoxins. And then if people are just dosing at home and maybe not mixing it correctly or maybe overdosing themselves, you can have really, really severe side effects. So that worries me a lot. This is a powerful metabolic agent and it does require some medical oversight. Oh, this is a great question. Will this be lifelong? I, you know, Most of my patients, we use this to get to their goal weight, and then we start kind of a maintenance protocol. For some people, obesity is like behaves like hypertension, type 2 diabetes. This may be something we want to keep on the back burner or just keep in your kind of like maybe we're doing it once a month, maybe we're doing it every other week. Um, just to help maintain your goals. But overall, it's like this isn't a medication we want to be on a high dose for too long. We want to be able to transition to maintenance dosing. Maybe we're cycling this once or twice a year. Really, we want to create a metabolism that is resilient as possible, not dependent on your medication. And then future of metabolic medicine. This is so exciting, such a cool frontier. Definitely, retatrutide is on the horizon. It's here. We're looking at some oral GLPs that, if people don't want to do injections, that is a great option. We are looking at longer acting GLPs. Instead of doing a weekly injection, it would be a monthly injection. So that is super, super cool. I love this idea. We do a lot of muscle sparing combinations. I love to combine peptides. I love to combine hormone replacement therapy. There's so many things we can do while patients are on a GLP that make the GLP more effective. And there's fat specific targeting with certain peptides and diet. And this is all just leading up to precision metabolic therapies that are really tailored to the patient and tailored to the individual, which is kind of all we do here. That's kind of what we specialize in. And then, so the integrative model, medication, muscle, metabolism. Yes, the GLP works amazing, but it works even better if we have 80 to 100 grams of protein a day. We're doing some resistance training. We're optimizing sleep. We're regulating stress. We are supporting your micronutrients. And I also love to work on people's hormones, optimize the hormones, optimize GLP outcomes. So I really feel like this isn't a standalone therapy, and it's kind of it's difficult when I see patients that have just been on GLP and they haven't been optimizing everything else. That really leads to poor GLP outcomes in the long term. So, takeaways. I love that these medications have really shifted the dialogue from this whole obesity thing being a moral defect, right? That obesity truly is a metabolic issue, and we have solutions to those metabolic issues. Retatrutide, so excited about this next generation therapy, hitting three different agonists, increases fat burning beyond appetite control, but it is very powerful and it really does need to be used responsibly. And like I said, you're going to get the best results when you're doing a lifestyle integration, not just using the medication. And of course, this is for educational purposes only. Not all therapies are FDA approved. Individual medication evaluations are required. And then off-label use really does require informed consent so you know what you're getting into.
Thank you so much, Dr. Tade. I did see a question come in through the chat, so if you're ready, I'm going to read it off for us.
What
Uh,
you got?
what is the specific difference between semaglutide and retatrutide for blood sugar, not weight?
Um, so the studies are still coming out on retatrutide. They're looking very similar for blood sugar control and hemoglobin A1C. We're seeing that retatrutide is even more anti-inflammatory than semaglutide. So that's really, really exciting because think about it, your inflammation can also drive up your insulin, your blood sugar, and like your insulin resistance overall. So very similar, if not better, with retatrutide. Nicole, you're on
Looks like I
mute.
muted myself. Thank you. If there are any other questions, please feel free to send through on the chat. We're lucky to have this time with you, so it's a great time to have some of your questions answered. Let's see.
Yeah, that was a great question.
Let me see. Might actually give me one moment. I might have a list. I think we did have some questions submitted, so let me just check here too in this form. Let's see here. We do have another one coming in. Can you diagnose the negative consequences behind what you mentioned? And if there are any.
Negative consequences, what do you mean?
Let's see, please feel free to elaborate in the chat, but perhaps retatrutide in general, if there's anything that we would, I guess, sway us more in the direction of SEMA or TERS over retatrutide. If there's any more clarity, I will chime in though, but.
It seems that retatrutide has less side effects than semaglutide and tirzepatide as far as like GI, interaction. Less side effects. And really the biggest side effects that I worry about with sema and tirzepatide long term are the muscle loss. So that's what we are really liking about retatrutide is it has a lot more muscle sparing than sema and tirzepatide. I have been using sema and tirzepatide for 4 or 5 years now, pretty much since they came out. I've had none of my patients have had any like long-term side effects. I think so many people are so scared of these medications. I've never had anyone had their gallbladder taken out. I've never seen a case of gastroparesis. Somebody told me if they took it, they were going to go blind. I was like, I've given this to thousands of patients. No one has gone blind. Like,
Okay, that's great. It's a good thing. Thank you for
I
providing
know.
that
Yeah.
clarity there. Let's see, we do have more coming in. When will dispensing begin for retatrutide?
Reach out to our office.
Okay, simple enough. Let's see what else. What about hair loss? Is hair loss linked to this medication?
Okay, let's talk about hair loss. I need to do a whole webinar on hair loss because like I'm very, very passionate about it. These medications do not cause hair loss. You not eating and you not consuming enough protein is causing your hair loss. Does that make sense? So it's like the reduction in appetite, the reduction in calories, protein, all of that causes the hair loss. So it's like a side effect of a side effect of the medication. And yeah, and typically I'm seeing a lot of hair loss with people that are on really, really high doses or that have been titrated too quickly. And they're eating like 500, 600 calories a day. And I was like, you're not getting in enough protein when you're eating that little amount of food. And your body's going to pull protein just to survive. It's kind of like you're putting your body in like survival mode, which we do not want. You want you to be well nourished. I want you to have lots and lots of protein floating around your system. If you're under eating and you're under utilizing your protein, you are gonna lose hair. So that's why I start people off at a very low dose. We keep their caloric intake like pretty high, and just hit those proteins. I love the collagen peptides as well. It's just like there's so many sneaky ways to get protein in, and that will also help to kind of like guard against muscle loss and hair loss.
Okay. Yeah, that's a great point. And whenever we do talk about nutrition and diet, is there a specific, I guess, like cadence we should follow or pattern, small frequent meals or larger meals? Does any of that
No.
play into this?
I like small frequent meals. I like people eating within 30 minutes of waking up, which I feel like is such a revolution because everyone is just like waking up and like drinking coffee. And I'm like, okay, if you're going to drink a coffee, at least put collagen peptides in it, put a scoop of protein in it. Especially because your appetite is going to be a little bit less. You're not going to want to eat as much. I'm like, you may be doing like 3 meals a day, and then let's do a protein shake or let's do, like like a chomp stick just to keep your blood sugar stable as well throughout the day. Blood sugar stability is key as well for helping with weight loss. So I'm a big fan of these like small little meals.
Okay, that makes a lot of sense. We
Yeah.
do have another question that came through, and this is a trickier one, but I think it's definitely worth tackling. So there are a lot of online companies that may give you immediate approval for some of these medications,
Yeah.
and they'll ship them directly to your home, right?
Mhm.
So is there an advantage or a reason that it would make more sense to partner with Dose or come into the clinic?
Mhm.
Is it monitored more closely? What would be a reason to pick
So
one route over the other?
yeah, and like I said, I've had so many patients get it online,
Mhm.
and there are websites you can literally just go on there and buy it online, and it's so scary because you don't really know what you're getting. You don't know the potency, you don't know the toxin level, and like I said, I've had patients buy it online and spend thousands of dollars buying multiple vials, and they're injecting themselves, and they're not really feeling it. So I'm like, I don't even know if there's any active ingredients in there. So that always freaks me out. Anything that we're prescribing is coming from a 503A or 503B pharmacy. So it is pharmaceutical grade. I know if it's made out of in a pharmacy that they are testing for potency, right? I don't want you, getting this medication and injecting yourself and not feeling anything. It's also tested for sterility, endotoxins, all of that sort of thing. I want my patients to be getting the highest level, like the most potent, the most active, the most safe medications I can find on the market. So that's why I was like, we really want to, also have people under our care, monitor them. If side effects come up, we can address them really quickly. Whereas if you're just getting it online, you're not really getting that support on the back end.
Yep, that makes a lot of sense, especially for something like this.
I know.
We do have a question in terms of your day to day. Once you start a medication like this, would it be fair to say, your days will continue as normal? Should you maybe plan to start a medication whenever you don't have like something bigger coming up or a big event or a big plan? Is there almost an adjustment period that you should plan for?
I love this question. I love this. And I feel like I talk so many people through this because they're like, when should I start it? When should I do it? And I'm just like, I start everyone at such a low dose that this should not be interrupting. This should not be derailing. Even semaglutide, even tirzepatide, like I think the starting dose of tirzepatide is like 20 units. I start people at 5, which is a microdose. And I was like, you should just feel, hey, you're a little bit fuller. Oh, your energy's a little bit better. Oh, you're sleeping a little bit deeper. It's people that get really scared about starting it that they think they're going to go on a super high dose and they're going to feel terrible and they're going to have all these side effects. But again, that's why I dose so conservatively is because I don't want people to have a bad reaction or have a lot of side effects to the first few injections because then people get freaked out and then they don't want to continue the medication. So I'm always, I always tell people, the best time of the week to inject is Friday evening, right before you go to bed. So if you're gonna feel off, or you're gonna feel a little draggy, or you're gonna feel more tired, or whatever, you're gonna feel nauseous, it's gonna be over the weekend, so you can have a little more downtime. But again, I don't have a ton of people have bad reactions because we dose so conservatively.
Right. Right. And that makes a lot of sense. That's the best way to start something new, in my opinion. If it's anything, just slowly titrate up and
Yeah.
try to let your body adjust, give yourself that adjustment period.
Mhm.
Okay, let me see if I have anything else that came in. Oh, this is a big one that we've seen for semaglutide and tirzepatide. But in terms of nausea, is there anything that you can do to help minimize it, prevent it? How is
I
that?
get
What
this
does that look
question
like?
so much, so much. I like begged this patient to start Tirzep, and she has like the phobia of vomiting. It's called something like that. And she's like, I'm gonna throw up. It's gonna be terrible. Yada yada. And I was just like, if you're worried about it, I'm gonna go ahead and send in Zofran. I'm gonna send it to your pharmacy. I just want you to have it on hand. And again, I start people off at a super low dose. And I followed up with her like 6 weeks later. I was like, did you have any nausea? She's like, no. I was like, did you even use the Zofran? She's like, no. I was like, were you worried about nothing? She's like, yeah. I also tell people if you're you might have some nausea because your blood sugar is a little bit low because a lot of people stop eating. And so I'm always like, please eat protein throughout the day to stabilize your blood sugar. I don't want your blood sugar dipping too low because you can also feel kind of nauseous from that. But really, I don't see a ton of nausea.
Okay, that's great to hear. Yeah.
I know.
And I do have one more. I know we have 1 minute left, but in terms of maintenance, looking a little bit more down the road, what does that look like once you've reached your goal weight?
Great question. I get this question a lot. Once people have hit their goal weight, I start titrating them off the medication. And so it always ends up like, I'm like, okay, you're injecting every 7 days. We're going to go to every 10 days. Then we're going to go to every 2 weeks. At that 2 week mark, because the half-life of this medication, all GLPs, is about 2 weeks. So really, it's like almost out of your system. So I'm like, weigh yourself once a week. If your weight is fluctuating or if it's staying stable, we can adjust the dosage from there. So I kind of just extend the time in between injections and then I start lowering the dosage. Most of my patients will end up with a vial, kind of left over here or there. And I'm like, okay, cool. We're kind of tapered you off. We're maintaining your weight. If you have a vial left over, throw it in your freezer if you want to pull it back out. Sometimes they will cycle it again before they go on vacation, or sometimes they'll pull it out again before the holidays. But I tell people if you ever fluctuate more than 5 or 10 pounds within your goal weight, we need to talk about your diet, your lifestyle, what is causing the weight to come back on. And then we may want to start adding in a low dose of a GLP back into your system. For some people, they feel so amazing on this. Their inflammation is gone, their joint pain, their energy is better, their brain fog is gone, that they want to stay on a microdose long term. And really, the long-term studies for these medications show incredible benefit for longevity, for cancer reduction, for reducing heart attacks. So it's always a great conversation once you've hit your goal weight to taper, to go to a microdose. That's a great question.
Okay, I really appreciate all of your time today and answering all these
Yeah.
questions. Thank you
Yeah.
everyone for attending. There will be a recording that gets sent out. And then if you have any questions, feel free to respond to that. We'll try to get you connected and have your questions answered. We are always definitely trying to keep you informed and answer all your questions. So thank you so much, Dr. Tade. Thank you everyone for being here and have a great rest of your day.
Thanks, guys.
Thank you. Bye.
Bye.